All right, welcome to the November 10th, 2021 update for where we're at with COVID in Nevada County and what is going on and what's new. And Dr. Kellerman, yesterday we get some news from you. So where we're at, where's Nevada County at?
Well, we're in still a, most people would like to see the curve keep dropping, but kind of plateauing. We have so far 9,273 cases, sadly 105 deaths with a couple more in the queue. Our case rate remains higher than we'd like to see, 19.5 per 100,000. So it would keep us firmly in the purple tier by almost a factor of 2 if we still had that, the blueprint. The state average is 12.2, so we're higher than the state. Our positivity rate is 5.9. The state rate is 2.3%. Good news is from Sierra Nevada Hospital is that hospitalizations are going down and have remained stable for a while. So open up, obviously, people know that outpatient surgeries, pulmonary rehab, and cardiac rehab are all operational. The Optum Serve site is operating below capacity. It's still open 12 hours a day, 6 days a week, Monday through Saturday. 44% utilization, Grass Valley only 27%, and Truckee, probably we're talking about cutting back the hours a bit. Good news on immunizations is we've delivered about 127,474 doses countywide. 67.6% of eligible folks have been fully immunized and 75.1% have been partially immunized. People have concerns about side effects or efficacy, but 7.3 billion doses have been delivered worldwide. It's been proven to be safe and effective. Although we do have breakthrough cases, and they are concerning people fully immunized getting infected. You're 6.1 times more likely to get COVID if you're unimmunized, and you're 12 times more likely to be hospitalized if you're unimmunized. Of recent news is the third dose. The third dose has been approved for immunocompromised people. Those people who've gotten a third dose should 6 months later consider even getting a booster. That would be 4 doses total. Boosters have been approved for Pfizer and Moderna. Those OJ 65 and long-term care facilities or a job where you have exposure. That's 6 months after your second dose. My guess is that if you feel like you need a booster and you feel like you've been exposed, please get a booster. Pharmacies are offering boosters, Western Sierra, and of course, Lineage at Chapaday. The Johnson & Johnson booster has been approved. That's 2 months post your initial shot. That's for 18 and old folks, 18 and older. It turns out mixing and matching is actually positive. If you receive a J&J booster, if you get a second J&J booster, antibodies are increased by 4-fold. If you had a Pfizer, 35-fold, and Moderna, 76-fold. However, again, the science is the Moderna booster was the one tested on those was a larger strength than the one that's being currently used for boosters. 5 to 11-year-olds have been approved. The Pfizer dose is 10 micrograms compared to the adult dose over age 12 of 30 micrograms. Pediatricians, FQHCs, Western Sierra, Chapaday again, and Docomo's will be the providers of that. Public Health we'll be having a clinic on the 16th at the Veterans Hall for 5 to 11-year-olds. Come one, come all, but 5 to 11-year-olds, and of course they have to have a parent. We did change the mandates, and that just happened yesterday. We removed the prohibitions on gatherings of greater than 2,500, and we centered the requirement that for over 500 need to prove immunizations or a negative test. Still, masking is in place for indoors and outdoors if you can't physically distance. And the good news is for performers, if they've been vaccinated and test negative within 24 hours of the performance, no mask are required. And I spoke to a Rotary Club this morning, and apparently there was a musical event where everybody was tested, and the performers came out wearing masks, and you hear a groan in the audience, and they announced they've been tested, and they're all immunized, and they pulled off the mask to a standing ovation. So it looks like we're heading back to normal. So that's the good news. Thanks.
No, that's that's great news, and we had quite a few questions, of course, from parents now, since the kids are now eligible to be immunized. And maybe Dr. Stevens, can you maybe talk a little bit about, so let's say that there's an 11-year-old and then there's a 12-year-old. So the 11-year-old gets this much, quote unquote, weaker dose. So can you explain the whys and wherefores?
Yes, of course. So the study that was done was actually on that 10 milligram, the lower dose for that age group. And the CDC does say that if someone is 11 and they turn 12 before their second dose, they just get the dose that's their age. So if they are 11, they get the 10 milligrams, and then 3 weeks later, they're 12, they get the 30 milligrams as the booster. Immune systems are different at our different ages. And so there's some thought there. The other thing is, trying to decrease the risk of things like vaccine myocarditis, which is extremely rare. But, that's also part of the thought about the lower dose there. And just keeping in mind that children at the peak of the last surge in that age group, the sixth leading cause of death was COVID in that age group. So vaccination is so important to protect our kids from COVID. And as we move into the winter months, we're all going to see a little bit more respiratory illness circulation. And we're already starting at a higher baseline, like Dr. Kellerman was talking about.
And just to add on that, I know you've had UC Davis experts talk about long COVID, but we thought that kids, that would not be problematic, but a recent UK study showed that 13.3% of adults suffer from long COVID. With the 2 to 11-year-olds, only slightly less, 12.9%, suffer symptomatology for a long COVID. And you don't want to encumber a child with lethargy and brain fog. All the symptomatology, shortness of breath that long COVID can carry for quite a period of time.
And then there's other secondary outcomes like missing school and, being behind and things like that. So it's really important if we can protect our kids with flu shots this year and COVID-19 vaccines. And if you have any questions, your providers are here for you to answer them.
Yeah, and I think that's always the important reminder that talk to your providers, because they know you, they know the science. So it's talking to the providers, because, well, who doesn't trust their doctor? Because otherwise, why would you go see a doctor? We have a question from Bob, who's asking that they are planning an event, an in-person event on November 20th, which will be a sit-down event, listening to a speaker, and they will be requiring proof of vaccination, mask, and indoor distancing. But is there any easing of the social distancing, the 6 feet social distancing, for those that are vaccinated and masked? Can they put the chairs a little closer together?
Well, certainly if it's your family, that's not a problem. But if you're not sure, it's a little more problematic. What we do in public health is give best practices. There are guidelines, although there are mandates, and they carry some weight to them being a mandate and some penalties. But these are just best practices, and the best practices, if you can mask and physically distance, you're the safest. But certainly it's been shown in classrooms that kids can sit close together and be masked and do well. So there is some science that tends to indicate that, it's a layered approach. Immunization is the primary thing, masking is second, and then down the line is the distancing.
And the other big thing is ventilation. So I know it's indoors, but if there's ways to improve it with the HVAC system or windows, that could be helpful. I think sometimes you can't socially distance, but the type of mask is important too. And this decision is so different as different people have other factors, whether they're immunocompromised or are taking care of someone who's immunocompromised, and they may want to be a little bit safer with that socially distancing. So allowing, if you're going to, not do the 6 feet, allowing space for some of those folks to have space if they need to there.
Yeah.
And we obviously encourage people that are not well, stay home. Got a runny nose or you're coughing or sneezing, just please, stay home. There's other viruses out there besides COVID that can be passed on to your friends and perhaps people sitting next to you.
And we just get some clarification. The event is for the American Association of University Women. So it's a bit of an elderly crowd, but they're all vaccinated, and it's going to be at Peace Lutheran with 45 or more in attendance. So probably the social distancing would still be a good idea.
It's a good idea. But they're smart people. They'll figure it out.
And talking about runny nose, so you get your booster shot, but you haven't gotten your flu shot. So how long do we have to wait between? Or do we have to wait?
Melania, you want to address that one?
You can get both of them at the same time. There's no interval that you have to wait in between. If you're worried about more side effects, if you're one of those people that get a lot, you could stagger them. But at this point in the season, I do recommend, if you haven't gotten them, to get them as soon as possible.
That applies to childhood immunizations. You can bundle them all, get them at the same time.
And another question is that most of our pharmacies only carry Moderna. With the children's Pfizer rollout, will more of them be supplying Pfizer, at least for the kids vaccine?
That's a conversation, work in progress. Docomo's is the one who stepped up to the plate. They've been doing it for our county for quite a period of time.
And they carry Pfizer, as far as I know.
They carry Pfizer, and they've agreed to do the 5 to 11-year-olds. That's a tough one because there's some pushback. Obviously, needs a lot of parental guidance, and there can be some screeching. Probably pharmacies that doesn't appeal to pharmacies, but we really feel that the providers should be the ones that know the kids, know the parents, and can discuss it as best as possible. We're offering an immunization clinic in Docomo's, obviously, is on a regular basis, but we really encourage people to seek a medical provider. It looks like the providers for pediatric care will be engaged in providing these immunizations.
What about people who maybe just recently moved or who do not have a pediatrician? Where can they get some help?
They can go to Docomo's, and they certainly can come on the 16th to our clinic at the Veterans.
Mm-hmm.
Apparently, there's going to be kind of a dress motif. I don't know whether you do that over Chapel Day, but it could be insects again. So it'll be upbeat. There'll be balloons and good times.
Great. And welcome, Dr. Trochet. Glad you could join us. Hello.
Thank you. I'm sorry I'm late.
No,
I was on the road.
We all know the serial Zoom meetings, and especially, and then one runs over it. Everybody's fully familiar with that. So here's one. The daily updates on the active hospitalizations, could they be broken out by vaccination status of the patients, and just to reinforce the benefits of vaccination and perhaps help increase our vaccination rate?
I know you want to take that.
Okay, yeah. On the average, our hospitalizations are mostly unvaccinated people, but it does fluctuate because the hospitalizations for COVID have been in the range of 12 to 15 people. So if you have one vaccinated person, you start to talk about percentages. If you have one vaccinated person out of 10, that would be a 10% vaccination rate among those hospitalized. And that's really not accurate because it really does vary. In general, the hospitalized patients are mostly unvaccinated. And we do get about 10% vaccinated, hospitalized on the average, if you average out the number of people who are hospitalized. On the
And-
whole, the vaccinated folks, even when they're hospitalized, do better than the unvaccinated, with very few deaths, although there have been deaths among vaccinated people. And very few of the folks that are hospitalized end up in the ICU if they're vaccinated. So the illness is milder if you're vaccinated.
And we have Katie who notes that when she called Sierra Care pediatricians the day after the immunizations were approved for the 5 to 11, they said they didn't know when they would be getting the vaccine. Does anybody know? Because she wants her kid vaccinated and she hopes that it has changed by now.
I never call back.
Yeah,
been working
vaccines
on it.
have been distributed since last week,
Yeah,
but everybody's different and it depends when you ordered it, when you're going to be receiving it. But yes, absolutely call back because they are available.
And then Nancy asked a question about if other vaccines like Novavax, for example, will be available once there is the emergency use authorization. Is that anywhere on the horizon? Because there are people that don't want the Moderna or Pfizer, and so she wants to inquire about Novavax.
the vaccine market's pretty full right now. I mean, apparently, from what I've heard, is that we've accumulated enough immunizations in our country to immunize every American three times over. So I'm not so sure that there may be other vaccines approved, but where they would find a niche in the market is going to be a bit problematic. And then obviously in public health, our eyes are open to other parts of the world, and here we're talking about boosters and approving different immunizations when so much of the developing world, the poorer nations of the world, are still remain unimmunized. I know where I have a lot of familiarity in Uganda, less than 2% of the population is immunized. So our focus is primarily at public health is immunizing, giving a primary series to people, not so much to boosters, because it's the unimmunized, as Dr. Trochet said, that are ones pretty much in our hospitals these days, and then advocating for a worldwide distribution of immunizations.
And for Novavax, I think it looks like it's going to go to the FDA at the end of January. So I just want to caution folks for waiting for that because we are heading into our biggest respiratory season. So if you are thinking about getting vaccinated, please try to do that now or soon because that will really protect you against disease burden coming up.
And not to mention that there's stuff besides COVID and flu, and of course the kids, whooping cough has had outbreaks here in Nevada County. We seem to manage at some point is all of a sudden there's a whooping cough outbreak, and which is also one of these very preventable diseases.
Yeah.
And another thing that just came out today was the WHO and the CDC also mentioned that in 2020 there has been a large setback as far as measles go, measles immunizations go, because while they had fewer cases reported, the immunization for measles basically, especially in lesser developed countries, came to a complete halt. That's another thing. So we have the option of protecting the kids. So it'd be really nice if everybody took advantage of it. And again, if you are hesitant, which is perfectly okay, but talk to healthcare providers, talk to the pediatricians, because it's so much easier to take an hour off of your time to get your kid vaccinated than if all of a sudden they get really sick. And that's actually a question that we got. It's do parents get time off to take their kids to get vaccinated? Is there any option? Has the state said anything that parents get time off work to take their kids to be immunized?
I'm afraid that that's really up to the employer. We would certainly encourage employers to allow their employees time off to get their children vaccinated and to get themselves vaccinated. But I have not heard, Dr. Stevens or Dr. Kellerman may have, but I have not heard of any state mandate that would require employers to give time off for vaccination for children. There was a mandate that employers had to give time off to employees to get themselves vaccinated. But I don't know about getting your children vaccinated.
Yeah, it's I think some of the heaviest lift in our country is single moms. And what do? You know, when your kid falls on the playground or needs to be immunized, and you're the breadwinner. So I think there should be some special concessions made in that area. Pascal, maybe you could advocate on your show for that, and maybe have Gavin on and grill him.
Yeah, well, we'll have to put that on the list of questions when we get our exclusive sit down, which might be a while. I think there might be some outlets before us, but hey, we can always try. One more thing about the events now. Now that there is no requirement to check vaccine status, and also there have been anecdotal reports about vaccine cards that looked a little funny. So who might have been, well, either printed off a template or something. How, if you are, the person is asking, if you are vaccinated but have, for whatever reason, a weakened immune system, should you go to events where people what you don't know, some like music events or meetings? Should you go to these events, and if you go, besides the obvious mask wearing and attempting a social distancing, what's your recommendation?
So for people with moderate or severe immunocompromised, even 3 doses actually does not equal to the amount for an immunocompetent person. So the vaccine is protecting them, but really not to the extent that they probably want. So I would definitely do a layered approach. So ventilation, again, is really key. So if it's an outdoor thing where they can be masked, that's definitely safer and socially distanced. Otherwise, I would be more careful if they are immunocompromised, because, you know, they do have a higher risk of getting hospitalized. And some of the breakthrough infections that Dr. Trochet was talking about were in people with other medical conditions as well.
You're muted. Luna.
We all need to do our own risk assessment. I think some of us are more risk adverse than others. So it's really we need to give you the information so that you can make your own risk assessment of what feels safe to you. And certainly getting immunized, and if you're 6 months past your second dose or 2 months past your J&J dose, getting a booster if you're in the group that should be getting a booster shot, wearing masks, staying away from people, as Dr. Stevens said, the ventilation, and also knowing who you're going with. If you are going to go to a venue where they do check vaccination and they insist that people wear masks, that's probably safer than going to a venue where it's a free-for-all and anybody can show up, and some people wear masks and others don't. So I think we really all need to do our own risk assessment and do what feels safe to us. But the safest thing is getting fully vaccinated, getting a booster if you need one, and wearing a mask when you're out in public.
And of course that's pretty much valid for any event where you are with people that maybe you don't know, and even non-events such as going to a grocery store. And it's the same thing. ventilation is, yeah, but grocery stores, the order and the pickup out in the curbside pickup is still available for some, but most people are going back to grocery stores. So there's maybe the sanitizing the hands, just because that's really just a good idea for all the other infections and viruses that are out there. So you might not want to grab the handle of that shopping cart and then rub your face. That's generally a bad idea. And well, almost to our deadline. So summing up, Nevada County, we're doing better. We are probably on the right path. Immunizations are still not where they could be. What can we have the holiday seasons coming up. I mean, some of us are still recovering from the sugar rush of the various holidays, but the next holiday is coming up, Thanksgiving. There is a lot of talk that this is going to be one of the busiest Thanksgiving travel seasons. So for people who will travel for Thanksgiving, for example, on an airplane, is there anything extra that they can do to protect themselves and their friends and family that they're going to see, and or when they come back? Is there anything else? And what if your appointment, if you get your booster shot, say you get a booster shot, and the next day you're traveling the next day. Well, first of all, if you have a reaction, well, but how fast does it kick in?
So it's usually 2 weeks after you're a vaccine that you have good immunity. Definitely right now is the time to talk to family members who are not vaccinated that you're going to hang out with on Thanksgiving, to get their boosters or get vaccinated. And then, you know, the airplane itself, if everyone's fully masked and they have good airflow there, is not as high risk. But what's high risk is actually the airports, because there's lots of people there. So trying to make sure you're socially distancing. If you can not check in a bag, so you're not waiting at the baggage claim, or those sorts of things. And then obviously masking, being safe there. If you're going to visit someone who's immunocompromised, you still may want to do one of those antigen tests before you get to visit with them as well. So I think it's a layered approach, and it depends on, again, like what Dr. Trochet was saying, your risk and the risk around the people who you're going to be with. I know this year is going to definitely be different than last year because a lot of us are vaccinated, but trying to take those extra steps to be safe.
Well, and look, and it is as good as 12:30, so we made it, and hopefully maybe we'll do one more in December just to take stock of how we're going to end 2021 as far as COVID and our cases go. And meanwhile, I would like to thank the three of you. Thank you so much for showing up for these, for sharing the good info that we all need to hear, because we all want to be safe. We all want to get back to whatever was considered normal, and maybe we can even do it a little better than before. That would be really nice. But thank you so much. Enjoy whatever comes up next. And tomorrow, of course, is Veterans Day, but then we have Thanksgiving that's going on. Hanukkah is coming up. So everybody be safe, enjoy, and maybe don't overeat, because that too can be a health risk. Thanks, everybody.
Thanks, Pascal.
Bye.
All the best.